Okay, ladies and gentlemen, welcome to this workshop session. And welcome to learn something about osteoporosis, costs what are related to osteoporosis, porotic fractures, and how we can significantly decrease those costs with a new technology. My name is Ossi Riekkinen and I'm the CEO of Bindex. Bindex is one of the most promising life science startup companies in Scandinavia. Last year we were selected to be one of the most significant new medical device manufacturer in Europe. We have very long history in osteoporosis research. We are a startup company from Kuopio University and Kuopio University Hospital, but I have also very strong personal relationship to osteoporosis. Because my grandmother-in-law, Elli, she is at the moment 83 years old. Head is working very nicely, but she hardly can move. She moves like this, and she has to use wheelchair even inside the house. And only what we can do is use strong painkillers. And the reason for this condition is disease which name is osteoporosis. Of course, in this kind of cases, you start to think what you can do differently. Because in Elli's case, there were maybe 2 or 3 bone fractures before she got referral from primary care to the central hospital to the bone densitometry measurement with this kind of DXA device. But this is not a typical situation because osteoporosis is highly underdiagnosed disease. Worldwide, about 75% of osteoporotic patients are not diagnosed, do not receive any treatment. And if you think about this situation in Finland, we have about 400,000 osteoporotic patients. Only 10% are treated. And we have even more these kind of devices in Finland than in UK if we compare to the size of population. So there is no true access for this kind of measurement because this is in hospitals, not in primary care. And if we think about costs related to the osteoporosis and osteoporotic bone fractures, we have different kind of references. We know that in Europe about 40 billion annually, USA 20 billion, UK 2 billion. So billions and billions. So this disease is very high, includes very high costs. But what kind of disease osteoporosis really is? Here we can see 2 nice images. Here we have a normal bone, hip bone, and osteoporotic hip bone. And the basic situation is that bone mass has decreased and structure has changed. And for example, if we look this cortical bone area, we see that cortical bone thickness in osteoporosis will decrease. And these are related that if we compare totally normal bone density, patient with totally normal bone density, to the osteoporotic patient, there is 11 times higher fracture risk. So how common this disease is? In UK, it is estimated that there is 3 million osteoporotic patients. Worldwide, 200 million. And as you can understand, this is very common disease. There is very high costs related to this disease. Hospital-based diagnostics is not the solution. We cannot handle those patients in hospitals. And that was the reason why we developed Bindex. So Bindex is world's first reliable point-of-care instrument for osteoporosis diagnostics. And if we think about my grandmother-in-law case, we drank a cup of coffee in the kitchen and at the same time I make the measurements. So it is totally different than send patient to the hospital. We have CE mark and 1 week ago we received FDA clearance for this technology. And now we have done clinical validation with over 2,000 patients. And we really can say that we can diagnose 70% of patients under osteoporosis suspicion to be either healthy or osteoporotic, and only 30% really needs hospital-based DXA measurement. Then if we think about benefits, what this kind of technology may bring, of course the patient is the key, because with this kind of technique we improve the access for diagnostics, we improve the access for effective treatment for those patients who really benefit from the treatment. And with that way we prevent fractures and improve the quality of life. If you think about private clinics, this is new service for them. This is very important service for them. Then if we think about public healthcare and insurance companies, do you know what this means? What we will save? Money, 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 money. Because we will decrease the costs from diagnostics and significantly decrease the costs from bone fractures, which is the big issue. Then if we think about pharmaceutical companies and nutritional companies, it is extremely important to increase awareness of this disease. And with awareness, we can expand the access for effective treatment and nutrition for those patients who really benefit from the treatment. After this introduction, I will demonstrate this measurement for you. I will be the test patient, so there is no patient security issues. In this case, I share my information for you. But this is the basic principle how we make the measurement. So we measure tibia bone. Tibia is pipe bone. So when we move transducer over the bone, we will see clearly two echoes. And the first echo comes from the upper surface of bone, and second echo comes from the inner surface of bone. So the time difference of those echoes tells us what is the thickness of cortical bone layer. And as you remember, what was the biological definition for osteoporosis? Cortical bone thickness has decreased. But by using this information, age, weight and height, we analyze density index. And density index is now our estimation for hip bone mineral density, which is measured in hospital with DXA. And here you can see the measurement report. So you can see cortical bone thickness, small one here, but the key is this density index. And you can see density index as a numerical value, but also in this green, yellow, red bar. And that is now important, because Bindex is calibrated against hospital-based DXA measurement. And now we know that 90% of real osteoporotic patients measured with DXA in hospital will get measurement result with Bindex, which is on red or yellow area. And now 90% of non-osteoporotic patients with hospital-based DXA will get measurement result which is on green or yellow area. So when those patients who are on the yellow area are measured in hospitals, we have 90% sensitivity and specificity for osteoporosis. And we have national guidelines in UK, but also in Finland, and international guidelines that if we have patient with risk factors and we get measurement result which is on red area, that is enough indication to start treat patient. We do not need DXA. But where that calibration comes from, and this is now very important to understand, and this is very logical to understand. So we have certain diagnostics, and we select patients with that for the treatment, and with treatment we try to prevent fractures. But the key thing in this pathway is treatment, because now all pharmaceutical trials are done by using DXA. And with DXA we have select who are osteoporotic, who are not osteoporotic, who will get treatment and who will not get treatment. And with that way we really know who will benefit from the treatment. And that is the reason why we have to calibrate, if we use some other technology, against DXA and analyze these 90% sensitivity specificity threshold. So we start to select same patients for the treatment. And this is now exactly same than that green, yellow, red bar in the result sheet. And this is also the only way how you can really calculate what is the cost effectiveness of this pathway. And I will show it, the data for you. So this is very new data. Early this year, published in Osteoporosis International and also in World Congress of Osteoporosis. So we measured 445 patients under osteoporosis suspicion. Normally all went to the central-based DXA measurement. We analyzed this 90% sensitivity specificity threshold, so we analyzed that green, yellow, red bar. And what was the interesting? Normally 100% of those patients would go to the hospital. If we use Bindex, only 30% really needs that DXA measurement. So we can diagnose 70% of those patients in primary healthcare. Then we investigated how this green, yellow, red bar works in larger population. In USA and in Finland, 1,830 patients. Results are totally same. 30% are in yellow area, and if we look real osteoporotic and real non-osteoporotic patients, sensitivity and specificity is about 90%. So technology works, but now the question is, what is the position of this device and technology in current diagnostic and treatment guidelines? In Finland and in UK and most of European countries, we use so-called FRAX calculation tool. And now we have to thank UK and Professor John Keynes and his colleagues about this tool, because with FRAX, we ask about 7 yes or no questions. So this is risk factor questionnaire. And the good thing in this calculation tool is that medical doctor in London, a medical doctor in Manchester can evaluate the patient with same way. And you also will receive information when you should send patient to the DXA. And in this study, we investigated that how about if we do not immediately send patient to the DXA, but we do Bindex in this phase. And the interesting was that in this pathway, when we use FRAX and Bindex together, only 16% of patients need DXA measurement. If we do not use Bindex in this phase, then 57% of patients would need DXA. So we have gone through this clinical evidence, but how about cost effectiveness? We have evaluated 2 different pathways. The current pathway, where we use FRAX, and with the FRAX score, we select who go to DXA, and then who are treated and who are not treated. Then we make new pathway, where we, after FRAX, use Bindex, and only those patients who have yellow result with Bindex, those are sent to the DXA. And now we have to understand that this pathway is not just screening cost. We have nurse working time, we have medical doctor working time, we have travel costs, we have screening costs. And this pathway in Finnish economic data, it is almost 500 euro. And I assume that it is pretty close to UK economy data also. But if we use Bindex in that phase, we can reduce the cost over 200 euro. Then we evaluate these pathways with 5 different patient populations. We used 65 years old woman with previous fracture, 75 years old woman with and without previous fracture, and 85 years old woman with and without previous fracture. All of these patient groups, if we use FRAX, needs DXA measurement. And then we investigated what is the effect of screening cost in cost effectiveness. And if we use 50 euro to 100 euro screening cost for Bindex, this is still extremely cost effective. And the lesson of this study is that the screening cost is not the key. The key is simplify the process. Because there you can decrease the costs. And then we all watching this fighting against Hillary Clinton and Donald Trump. And this is also a message now to the USA, because we have clear evidence that when we increase bone densitometry measurements, we will significantly decrease the costs from bone fractures. And at the moment in USA, there is about 2 million bone mineral density measurements. But that is the real world. But the clinical need, if we look guidelines, is that there is need over 50 million bone mineral density measurements. And if we use, for example, this kind of cost-effective technology, and we measure only 25 million risk group patients, we will save over 2 billion in USA. So now, Mr. Trump, Mrs. Clinton, do you want that your citizens in future go like this or go like this? It is your decision. And I look forward invitation to support your president campaign, because I think that the greatest country in the world needs strong leader, and with this instrument we can measure who is the strongest. So, summary slide. So we will significantly reduce the costs from bone fractures, and we want to improve quality of life with lower costs, and we want to be most preferred partner in the area of osteoporosis. And now, if you would like to ask something after this session, here you can see my contact details, and also here are contact details for our distributors in Europe at the moment. And now we start the second phase of this workshop, and that is the live demonstration. And now, just a moment, I open the computer, and now we are waiting the demo effect of this workshop. So what we are doing, I will show it to you, my critical information, what are needed for this kind of measurement. Just a moment. Okay, and now I should press this button. Okay. So, there is my name, my date of birth, sex, ethnicity. Then we have to put weight, 88. Then my height, 2. Then we have to measure where is the right measurement location. And for that we use this kind of measurement stick. So the measurement location is 1/3 of length of tibia under the knee joint space. And in practice we measure left leg, but I'm right hand, so it is easier for me to now measure right leg. So we feel knee joint space and put little mark there, just like this. Yes. Okay. So I have marked now knee joint space. Then there is a little arrow in this measurement stick, and this arrow will be now located to the distal head of tibia. Okay? And then we look what is the number in this measurement stick. It is number 10, and we have a second scale here, and we can look where is number 10 over there. So that is measurement location. So now this is 1/3 of length of tibia. And then what we need, we put here number 10. Then we calibrate device. And now we have that demo effect. We put some ultrasound shield. Now we are waiting for the software. And nothing happens. Let's do this way, just a moment. And in this phase, we need to drink some water. Yes.
You just need the metal bit. You just need to lift up the metal bit. Lift the metal bit up.
Ah. Well, now we lost connection to the whole computer. Can you please help me? Nothing happens. And now in this phase, when we struggle with the computer, we can a little bit change the program that let's take questions and
I can't read Finnish.
questions now.
It's just crashed, isn't it?
So please, if you have any questions.
Comment and a question. You clearly highlighted the importance of treating osteoporosis so that it doesn't remain unaffected and untreated. But one could actually say that for the health of the nation, it may be just as important to try and prevent the osteoporosis from developing in the first place, rather than treating those that have got clear-cut osteoporosis, which is what you're attempting to deal with. So the question is, osteoporosis affects the body in different ways and at different size to different extent. For example, the neck of femur and the spine are often affected. So when you take a measurement in the leg, how well does it correlate with these other measurements at the site where people are vulnerable in terms of fractures? When you are doing sensitivity and specificity, are you relating it to a measurement for DEXA done for the bone mineral density in the whole body at a localized area, or combinations of these?
Great questions, and that was the key thing when I discussed about the calibration, because now all those 2,000 women were measured with Bindex from the tibia and with the DEXA from the hip. And the key thing is now to analyze this green, yellow, red bar against DEXA. So we have against, for the DEXA osteoporosis, we have 90% sensitivity and specificity. So DEXA is the definition what we have used for osteoporosis. Yes, please.
This is very non-medical, but my brother found out he had osteoporosis. He's in Australia, and he found out he had osteoporosis when he was 50. So I'm from a very big family, so he told all the rest of us so that we could actually get tested. And some people decided to and some didn't. But when I got tested, they did 2 different tests from 2 different parts of me, and they said because the curves were different, then it was quite likely that I was going to get it. So that was several years ago. I now have osteopenia, but it was very interesting that actually he would never have normally got picked up. It was only because it was something that his particular doctor was specialised in. He was very excited when he told him that he'd got it, because it was his specialist subject. But I just wonder how you can, it isn't always a typical thing. How will people know to get tested? Do you know what I mean? Is it something that could become a much more common general test?
In Europe, we think that there have to be some risk factors before we start investigate the patient. And that is the reason why to use FRAX, because then we can find those patients who are most highest probability for osteoporosis and fracture probability. But in USA, we have different kind of guidelines. And in USA, the age is a risk factor. So over 65 years old, that is risk factor.
Well, my mother had osteoporosis, but it wasn't actually diagnosed until she'd had several fractures.
Same
and I was
case
absolutely shocked how many fractures she'd had, and it still hadn't been diagnosed.
That is the challenge. Now we have connection to the computer. So now we are on the same phase. So I calibrate the device, and now measuring is on. And now what I'm doing, I will move the transducer over the bone, and when I see clearly those 2 echoes, I stop the movement, and software accepts the signal. So with this way, I repeat the measurement 5 times. And that's it. We can see now those 5 measurements. So the first echo comes from the upper surface, and second from the inner surface. And time difference tells us what is the thickness. Here are those all 5 measurements. And in this phase, we also make statistical analysis that we compare these measurements against. Now all are green, so this is accepted. Then we can continue, look the results. And here we can see my cortical bone thickness was 3.2 millimeter. By the way, in my left tibia, it is 2.8 millimeters. So there is differences between the sides. And now by using this information, age, weight, and height, my density index is 1.02. And that is now our estimation for hip bone mineral density measured with DEXA. And you can see with the arrow the measurement result. So this is fast. This is easy to use. And we have very good clinical evidence that this is reliable. So thank you. So if you have any questions, I look forward to answer. There is one.
Do you measure, are all the bones similar? You use your tibia, is that representative of all the bones in your body?
In clinical validations, we have measured 2 sites in tibia and 1 site in radius. But this proximal tibia site is the best predictor of hip bone mineral density.
So, how does somebody get it done?
Excuse me?
How does somebody get it done right now?
Right now, when you come to the exhibition area downstairs, I can measure. Yes, that I was serious.
How are you going to make the service available
that is why we are here. So we are looking for different opportunities. So please come to discuss with me and Tony in exhibition area. Okay, thank you.